Thank you for participating in this important overview of the available advanced care planning resources and services for residents of Idaho nursing homes. Honoring Choices Idaho has developed this advanced care planning advocate training to increase the awareness of available advanced care planning resources and the importance of advanced care planning for all adults. Upon completion of this program, participants will learn the basics of advanced care planning to be able to share with residents. They will learn to recognize factors influencing the resistance to participation in advanced care planning. They will learn how to invite residents to participate in advanced care planning conversations and learn about best practices in advanced care planning documentation. Honoring Choices Idaho was initiated in 2016 with seed funding from St. Luke's and St. Alphonsus Health Systems. The initial focus of HCI's work was to help health and community-based settings integrate advanced care planning that targeted healthier adults and adults with a well-managed chronic illness. The goal being to influence culture change, stressing that advanced care planning is important for all adults regardless of age or health status. With a grant from CMS's Civil Money Penalty Funds, HCI has the opportunity to work with Idaho nursing homes to support integration of best practices in advanced care planning. With this new opportunity comes a new focus, focusing advanced care planning efforts to meet the needs of those who are much more ill and or frail. Honoring Choices Idaho uses the Respecting Choices model of advanced care planning. This is an evidence-based model proven to increase the percentage of individuals who have a documented advance directive. This program was developed in the early 1990s through the Gunderson Medical System in La Crosse, Wisconsin. Advanced care planning is not a one-size-fits-all, nor a one-and-done conversation. Person-centered advanced care planning must be individualized to a person's stage of illness. It must motivate individuals to participate and must integrate cultural or religious values and beliefs into planning. This diagram represents the common trajectory of a chronic illness, where 80% of individuals will contract a chronic illness that will advance over time and involve a dip or an acute event. These acute events are unpredictable, and they often can result in death. Patients who survive these dips typically do not return to baseline of health. Each stage of illness represents planning opportunities to address changing needs and goals as one's health begins to decline. Advanced care planning can and it should be individualized to the stage of health and woven into the delivery of good health care. Early advanced care planning is advanced care planning for all adults. These are conversations to be had when people are feeling well, rather than during an urgent or stressful circumstance. Conversations focus on selecting a well-prepared healthcare agent, identifying goals and values, and determining preferences for a what-if health scenario. Serious illness conversations are targeted for those whose illness has advanced, when their plans and their goals may change as the burden of their illness advances or becomes more stressful on patients or caregivers. This conversation focuses on optimizing quality of life for those living with a serious illness. End-of-life planning involves asking what matters most. These conversations shift the focus to end-of-life goals and preferences. This type of advanced care planning conversation is relevant when the disease outpaces curative treatments and becomes terminal. Our work with nursing homes in Idaho focuses on this stage of planning. Let's spend some time to talk about data. The data help explain the why. Why is this important? So partnering with Boise State University, we wanted to know what Idahoans say about their end-of-life preferences. We replicated a survey conducted in 2006, again in 2018, and this survey of Idahoans indicated that people in Idaho have strong preferences about their own end-of-life care. The majority want to die at home. They're worried about finances related to end-of-life care, and they're worried about being a burden to loved ones. People in Idaho want to be involved in making decisions about their own death. The majority want to be informed of their health and treatment options and be involved in the decision-making surrounding their health care. Here's some more data from that 2018 survey. When asked, who would you trust to provide information about end-of-life, note that the respondents were able to select more than one response. Family and spouse were often selected. But above all, people trust their healthcare providers. However, only 14% had actually had conversations with their healthcare providers. The model that we are using is the Respecting Choices model. This is a model with a 20-plus year history originating at Gunderson Health in La Crosse, Wisconsin. Respecting Choices conducted research in 1995 and 96, and then again in 2007, 2008. They wanted to assess the impact of this advanced care planning model. As a result of the advanced care planning program, they saw an increase in the volume of advance directives for people who had died, and an increase in the advance directives being available in the medical record where the person had died. And more importantly, 1 decade later, over 99% of the time, treatment decisions were consistent with the patient's stated care wishes and instructions. Effective advanced care planning has the power to transform the way that we deliver and provide care. So let's review some common terms seen in this type of planning. So advanced care planning is an ongoing shared decision-making process between patients, their families, and/or their caregivers, and/or healthcare providers. Different types of advanced care planning may be appropriate at different stages of life and illness, but they should reflect 3 common components: a reflection on goals, values, and beliefs, understanding of possible future decisions, and discussion with identified healthcare agents. So where advanced care planning is the process, an advanced directive is the document. An advanced directive allows you to write down your goals, values, and preferences for future healthcare decisions, and who you would want to communicate your healthcare decisions if you were unable to communicate them for yourself. There are 2 parts: a durable power of attorney for healthcare, where you identify a healthcare agent, the person you would want to communicate your healthcare decisions if you were unable to communicate for yourself. And note that a healthcare agent only makes healthcare decisions when that individual is unable to do so. A healthcare agent does not have to be a family member. It could be a trusted individual selected for that role. A living will is where one could identify goals, values, and preferences for future healthcare decisions. There are other terms that may be heard in this type of planning, including durable power of attorney for finances. This role is different from the durable power of attorney for healthcare. A durable power of attorney for finances is the person who is legally named to make financial decisions only when that person is unable to do so. The durable power of attorney for finances does not have authority to make healthcare decisions. And if an individual is interested in establishing a durable power of attorney for finances, they should be encouraged to seek support and advice from an attorney. As we continue to talk about advanced care planning terminology, it's critical to understand the distinctions between an advance directive and the Idaho Post, or physician orders for scope of treatment. An advance directive, it is a legal form. It is for anyone 18 and older, providing instructions for future health care treatments based upon goals and values. Importantly, it identifies a healthcare agent. It is not a medical order. It would not guide decisions or emergency medical personnel. It can be completed on one's own, only requiring a signature of that individual and the date. And it can be revoked or changed at any time. The Idaho Post is a medical order. This would be an appropriate document for anyone at any age with a serious illness and/or limited life expectancy if they wish to specify life-sustaining treatments that they want or do not want. These medical orders address life-sustaining treatments such as hydration, nutrition, help with breathing, and CPR, again based on values, goals, and current health status. The Idaho Post does not identify a healthcare agent. The Post would be used and followed by emergency medical personnel or other medical staff. It needs to be completed by a medical provider, requiring the signature of that medical provider, in addition to the individual or healthcare agent's signature. It may be revoked at any time, and this would be important to involve your healthcare provider in that decision, and it may be changed at any time as well. Completion of both an advance directive and an Idaho Post is always voluntary. So a key component of the Idaho Post is its portability. This is a portable document that directs care. And this is different from a do not resuscitate order, in which these are medical orders to not perform cardiopulmonary resuscitation in the event of a cardiac arrest. A DN order is site-specific. And an important side note, DNR does not mean do not treat. There are many ways in which healthcare providers may continue to provide support, comfort support, even if someone has selected a DNR. So let's spend a bit more time on the Post. It's important to note that federal guidelines for nursing homes indicate that a Post is not an advance directive. So a Post is not an advance directive. However, it can be an important document associated with advanced care planning. The target population for a Post is someone with a serious illness or advanced medical condition or advanced frailty at risk for a life-threatening clinical event, or someone who has had multiple unplanned hospitalizations within 12 months, typically with increasing frailty, decreasing function, and progressive weight loss. Or the target could be someone for whom a healthcare professional would not be surprised if that person died within 1 or 2 years. Again, the Post must be signed by a medical provider and the individual or healthcare agent, whereas the advance directive requires only that individual's signature. So why doesn't every adult have an advance directive? The reality of the situation is that most of us will die interacting with the medical system and may be unable to direct our own care at some point during an illness. Family members who are approached to make medical decisions are often uncertain or unaware of what their loved ones may have wanted. Nationally, about 26% of adults ages 18 and above have an advance directive on file. And remember the Idaho data, people trust their healthcare providers, but unfortunately, healthcare providers are not having this conversation with patients. Barriers and fears impacting the process of advanced care planning may be broad. many people view this topic as difficult or scary, which may lead to a lack of information about options and choices for medical care during advancing illness or trauma. People are often fearful to start a conversation about the what-if scenario, as if thinking of these situations may make it something that could be realized. Or often people think, oh, this will not happen to me. So how can we change the situation? It's not simply filling out a form. We can reliably change the situation by offering a high-quality process of advanced care planning in a system that is organized and encourages advanced directives to be created. Advanced directives are then made available to a healthcare team in order for clinicians to honor the medical wishes of the individual and support their healthcare agents at a critical time. This approach to advanced care planning is focused on the conversation, not simply completing a form. Within your facility, individuals will be trained as advanced care planning facilitators, trained to help lead individuals through a series of discussions about their experiences, values, and beliefs. This model also includes the involvement of a healthcare agent in these conversations. So those within your facility who are trained as advanced care planning facilitators will be trained to use general communication skills to promote person-centered conversations, to help guide the conversation with individuals and their healthcare agents. Each facilitator receives conversation guides to elicit experiences, values, and beliefs from the individual, all while allowing the advanced care planning facilitator to remain value neutral in their approach. So remember the image shared earlier describing the stages of planning. This training provided to facilitators within nursing homes will help support the conversation that includes providing information about the role of a healthcare agent, exploring the influences of experiences, goals, and values, making decisions about treatment options, assisting with the completion of an advanced directive, and confirming that advanced directives are stored in the medical records. For residents lacking decisional-making capacity, facilitators will learn how to help the healthcare agents in supporting caring, thinking about that individual's goals and values and the types of decisions that that person would want made on his or her behalf. At a high level, the steps to good advanced care planning conversations should include helping individuals select a well-prepared healthcare agent, allowing time for reflection, helping individuals connect their goals and values to medical decisions, and supporting individuals in the process of documenting and sharing their medical wishes in an advanced directive and/or a post. So changes may occur over time, and the advanced directive can and should be revised as needed. The most recent signed and dated copy takes precedence over any previous version. Often referred to as the 5 Ds, it's an appropriate time to review the advanced directive at every decade, after a divorce, if there's a death of an identified healthcare agent, a new significant diagnosis, or a decline in overall function. So as an advanced care planning advocate, there are 3 ways that you can support residents in advanced care planning. You can help assess individuals' understanding of advanced care planning. So does a resident have a current advanced directive and/or a post? You can review advanced directives and posts to ensure that they are up to date. You can provide resources, connecting residents with an advanced care planning facilitator, or helping provide Honoring Choices Idaho education materials. You can continue to assess understanding of advanced care planning. So as the health changes, does an advanced directive or a post need to be updated? Introducing advanced care planning can be a role of many staff members within your facility. Honoring Choices Idaho provides this introductory guide to facilities for any staff member to use. So another invitation example could be, I've noticed that you do not have an advanced directive in your medical record. Have you thought about who would speak for you if you were unable to speak for yourself? When asked that question, if the individual responds and they're interested, and if they have completed an advanced directive, you could share something such as, that's good to hear. I'd like to put a copy in your medical record. If you have a healthcare agent's contact information, I can put that in your medical record right now. It may be appropriate to follow up to ensure they really understand the role of a healthcare agent, and they may wish to have more information about this role. So you could provide them with Honoring Choices Idaho education materials that would be appropriate. If the individual has identified a healthcare agent but has not completed an advanced directive, you could share something such as, we have staff who could help you and your agent consider your wishes and complete an advanced directive. I can give you more information. And again, you could give them education materials or help connect them directly with a facilitator on your staff. So if the individual responds no, and they need additional information or encouragement, a great way to alleviate some hesitation and begin the conversation is by saying the first step in advanced care planning is that in that process is picking someone to speak for you if you're unable to speak for yourself. We call that person a healthcare agent. I'd like to provide you with more information about this role. Or you could say, we have staff who will help you and your agent consider your wishes and complete an advanced directive. I'll give you more information. So as mentioned, the advanced care planning facilitators, they will receive training to support the creation of an advanced directive. However, it is possible for other staff members to also support this process. Honoring Choices Idaho has a guide to help staff understand the various components of the advanced directive. And for access to this document, please reach out to Honoring Choices Idaho. Depending on your role in your facility, you may or may not have a role to support what is done with completed advanced directives or posts. However, as we've discussed before, documentation creation, storage, and retrieval are important steps in advanced care planning. It's helpful for everyone on your team to know about this process. An important question your site will have to consider is how will copies of advanced directives and/or posts be provided to the healthcare agents? After advanced directives are completed, they need to be stored in a reliable location that allows for them to be easily accessed if needed. So how are advanced care planning documents stored and retrieved in your system? How are notes related to advanced care planning captured? Are there ways to improve this process? I urge you to consider how you can help support this process. So these are 5 core promises that are the benchmark for advanced care planning upheld by HCI's partners. These are promises to our patients, our constituents, and our residents. Number 1, we will initiate the conversation. Number 2, we will provide assistance with this process. Number 3, we will make sure plans are clear. Promise number 4, we will maintain and retrieve these plans. And promise number 5, we will appropriately follow these plans. You are part of a statewide effort. Thank you. Advanced directives, they are available on the HCI website in English and in Spanish. These advanced directives parallel the value-neutral topics that residents are guided through when participating in a conversation. We suggest that you spend time on the website to become familiar with the tools that we have available on the website. Upon completion of this webinar, please email Lindsay, you see the contact information there, at Honoring Choices Idaho to receive a link for a brief quiz. This will certify your completion of this webinar. If you are interested in more information or have questions, please contact Lindsay with Honoring Choices Idaho. Thank you so much for your time.